The Korean government vows to bolster the medical system for areas outside the capital, often marginalized when it comes to critical health services. Eyes are now on the government's push to increase the quota at medical schools, against which doctors' groups oppose. Kim Do-yeon reports.
The government is making structural reforms in the medical infrastructure system to make sure non-urban and rural areas receive quality services in essential fields. President Yoon Suk Yeol acknowledged the severity of the situation on Thursday, noting certain areas were being neglected with regard to essential medical services as rural hospitals are unable to compete with large private hospitals in Seoul.
국민 건강과 생명에 직결된 지역 필수 의료가 붕괴되고 있습니다. 소아 청소년과 산부인과 같은 필수 진료 과목의 인력 수급이 어려워 적기에 치료를 받지 못하는 국민들이 많습니다. 또 지역 간 의료 격차 문제도 심각한 수준에 이르렀습니다.
The comments came at a strategy meeting on essential medical innovation at Chungbuk National University, where Yoon met with directors of national university hospitals to discuss how to tackle this issue. As part of President Yoon's plan, these national university hospitals scattered across the country will be fostered as core providers of essential health services under the jurisdiction of Ministry of Health and Welfare. They were previously under the Education Ministry. Another key issue for the government at the moment is to expand the number of students accepted annually at medical schools. Over the past 18 years, South Korea has kept the number of newly accepted students at 3,058. The government, citing that the OECD average for the number of doctors per 1,000 people is 3.7, whereas in South Korea it is 2.6, said raising the cap was inevitable. However, this could come with a backlash, as the previous Moon Jae-in administration attempted to do the same thing, stirring up strong opposition from doctors. That said, President Yoon has taken a cautious approach while acknowledging the need to increase the number of doctors. Other measures will support the changes.
산부인과, 소아과 등 필수 분야에 인력이 유입될 수 있도록 법적 리스크 부담을 완화하고 보험 수가를 조정하고 보상 체계의 개편이 아울러서 뒷받침되어야 합니다.
President Yoon added that medical restructuring was ultimately for the people, as the country's number one purpose is to protect their lives. The president also sees this issue as one of balancing regional growth, saying the lack of quality medical services in suburban and rural areas was why people were not moving into them. Additionally, the matter is directly related to the nation's economic growth. Kim Do-yeon, Arirang News.